To do or not to do? That is the question of a patient after lumbar surgery. Let's dive in. After an anterior, lateral, or posterior lumbar inner body fusion, there are post-surgical movement precautions, positional modifications, and lifting restrictions that you need to adhere to for approximately 6 to 12 weeks, or for as long as your surgeon deems it necessary. 4 movement precautions. You should not bend forward at the waist more than 90 degrees or raise knees higher than your hips. In a standing position, if you bend forward in such a way that your palms or your wrist goes past your knees, then that is a good indication that you are bending more than 90 degrees. 4 lifting restrictions. You should not lift more than 8 pounds. In addition to that, you should not twist your trunk while performing any lifting activity. If you are not lifting any load, then you can twist, but you definitely cannot twist towards the end range, especially if you would stay on that particular position. Just to put it into context, a 12-pack soda is 10 pounds, so you cannot lift that. A 1 gallon of milk is 8.8 pounds, so you cannot lift that. Meanwhile, a 2-liter soda is just 7.8 pounds, and a large saucepan is 1 pound, so you can tolerate lifting those. 4 positional modifications. When you are getting out of bed, you should perform the log roll technique, from lying down to a sitting up position. You also want to make note that you want to log roll with your shoulders and hips together. Make sure that the head of the bed is flat, and never log roll with the head of bed elevated. This can cause unnecessary trunk side bending. For step 1, start flat on your back with legs and arms straight. Step 2, bend your knee on the opposite side of the body and point it in the direction you want to turn. Step 3, reach with your arm on the opposite side of the body and lay it across your chest in the direction you want to turn. Step 4, allow your bent knee to roll across your body at the same time you reach with your arm, and then roll together, keeping your shoulders and hips together. Step 5, once you are laying on your side, bend your bottom knee slightly. Take your arm and place it on the bed in front of your body. Slide your legs off the bed at the same time your arms push up to prevent trunk side bending. And finally, step 6, sit with an erect posture and scoot forward so as the feet are flat on the floor. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.